Unlike popular belief, most women who carry the gene do not even have a family history of breast cancer. Now, but if you were to carry the gene, the lifetime risk of having cancers in the breast is up to about 70%, and in the ovaries, about 40 to 45%. Of course, the younger you are, the more likely you'll be carrying such mutations, and it is recommended by our own Singapore Cancer Network guidelines in 2015 for all women diagnosed under the age of 40 to go for such genetic mutation screening. So that's the bad news. The good news is that the 5-year survival among Singapore women has improved greatly over the years. As you can see here, from the 1970s till the last decade, there has been about a 50% improvement in the 5-year survival rate. And why is this so? And this has been asked to me many times, and this is a Straits Times article which I contributed to. And essentially, we can pin this down to two important reasons. The first is that we are detecting breast cancer at an ever earlier stage, and hence they are more treatable. And of course, on the other side, we have now far more effective treatment options, which I will share with you later on in this talk. So when it comes to the screening strategy, we start self-examination from the age of 20 onwards. We prefer that our ladies can do it on a monthly basis. And then when you're past the age of 40, we will add on clinical examination, not necessarily by a specialist like me. A GP is your friendly neighborhood GP will be sufficient. And also, very importantly, we add on the screening mammogram from the age of 40. So between the age of 40 and 49, we do yearly mammograms. Above the age of 50, we will do mammogram once every 2 years. Now, self-examination is something that we often ask our ladies in Singapore to do, but a lot of them don't really have an idea about how to do it. Actually, our Ministry of Health has come up with all these charts. This is taken directly from their website under the Health Hub website, and you can quite easily download this or view it there. As mentioned earlier, breast self-examination is done on a monthly basis, and if you are still premenopausal, then we would encourage that you do it about a week after the start of the menstrual cycle, where the breast is less swollen or edematous. We are also not asking for the earth when we ask you to do a breast self-examination, so don't be too hard or harsh on yourself. I put out a picture here where you see a strawberry, a normal size strawberry, in a bowl of peas, and that is what we are hoping that you can find. That you can find this strawberry in this bowl of peas. The bowl of peas representing the breast, and the strawberry representing the lump that one should quite obviously feel when you do self-examination. So the common signs of breast cancer, and by far and away, the most common would be that of a painless breast lump. There are other signs of breast cancer, but these tend to be much more advanced. For example, nipple discharges, skin dimpling or nipple retraction, a persistent rash, which is known also as Paget's disease. It is extremely rare. In my 20-year career, I probably have seen no more than a handful. Skin thickening and breast pain, these are all rather late signs. Now, you can see here in this little chart, if a lady doesn't do breast self-examination, usually they'll find a lump very big. This is measuring around about 1 inch or 2.5 centimeters. If somebody does breast self-examination, even without going for mammogram, they oftentimes can find a lump half the size of what somebody who is not schooled in breast self-examination. Unfortunately, here in Asia, most of our women has very dense breasts, even after menopause, and the higher the breast density, the poorer the accuracy of mammogram. So very often we find that mammogram alone may not be enough. There are newer mammograms that are available, and this is called 3D mammogram or tomosynthesis. It has essentially is a 3D version of the standard 2D mammogram, and it does boast of a higher detection rate for breast cancers, up to 40% better than the conventional 2D mammogram. It also lowers the false alarm or false positive rate by round about the same margin, 40%. However, it does incur a slightly higher radiation dose, but I think we shouldn't be scared off by the radiation dose. Just to give you an example, now in the light of VTL, the vaccinated travel lane, I can share with you, if you book yourself on the ticket or on the round trip to London, you will be getting the equivalent of the equivalent cosmic radiation of 1 mammogram. So how about ultrasound? It is something that we do very often here, especially in Asia, because ultrasound we find helps to detect things that are hidden by the mammogram. So I did actually audit study. This was unpublished, unfortunately, but back in the cancer center where we see more than 1,000 cases every year, I can share with you that about 20% of those cases were missed, or if somebody were to do mammogram alone, and it was picked up only on subsequent ultrasound. Here, any prevention or precaution to stop having breast cancer? Unfortunately, we cannot prevent breast cancers. We talk about preventive surgeries for ladies who carry the genetic mutation, the BRCA gene mutation, but really even preventive cancers do not completely take away the risk. It lowers the risk by 90%, but not 100%. So there is no way to prevent, but we can certainly employ many methods to detect the tumors earlier, so that it's far more treatable, like what I've shared earlier in this talk.